Hello and welcome to episode 79 of the Pet Behavior Chat. So I'm super excited for this episode because in this episode, I want to introduce you to my brand new course, which is called PSYCHOACTIVE. So as the name suggests, this is going to be a course based on veterinary psychotropic medications or veterinary psychoactive medications, also known as veterinary psychopharmaceutical medications. And the course is the tagline of the course is Practical Veterinary Psychopharmacology. So I want to chat you through in this episode a little bit about why I decided to create this course, what you can find in the course, who the course is made for, how I intend it to be how I intend it to slot into veterinary medicine in general, and all the things that you can expect from Psychoactive. So first of all, I think that we as vets didn't get great education around psychopharmacology or psychopharmaceutical medications at vet school. I certainly didn't. So I graduated just over 25 years ago, and I know for sure that psychopharmaceutical medication was not something that we learned about, certainly not for its use in behavior presentations and that sort of realm. And I also don't think it's being taught that much yet still at vet schools. And I think a lot of vets come out into practice and don't have that much experience with the use of psychopharmaceutical medications. So that's really one of the reasons I wanted to create this course. And I really wanted to create this course as kind of like a comprehensive course, a little bit everything you need to know if you want to use psychopharmaceutical medications, either within your practice in the realms of short-acting meds as pre-visit pharmaceuticals, or if you're seeing behavior patients, how those medications might slot in. And we're all seeing more and more behavior presentations, whether that's because we're more aware of them or because there just are more anxious pets around. But we're definitely seeing more and more behavior cases or, fearful, anxious, stressed dogs and cats. And I think, having a better knowledge around psychopharmaceutical medication is going to be something really, really useful. Now, of course, we as vets are the only ones that can prescribe. We're the only ones that can determine doses. We're the only ones that can assess drug-drug interactions and contraindications for medications. We're the ones that know our patients. We're the ones that know, do they have other chronic conditions or are they maybe on other chronic medications? So all those things I think are really important, because that means that we as vets are the ones that are going to be prescribing these medications. Now, that doesn't mean if you're, watching this podcast episode and you're not a vet, that this course is not for you. This course may absolutely be for you if you are a veterinary nurse, or if you're a non-veterinary behaviorist, or if you're maybe a trainer or working in any of those areas and you want to have more knowledge and more information about these medications. Maybe you're super interested in neurobiology or neurobiochemistry, then absolutely this course is going to also be for you. However, you know that you can't prescribe these medications, and that's something that is definitely up to the veterinarian's discretion. However, what I've also seen quite a number of times is that, non-veterinary pet care professionals that have really great knowledge and understanding about these medications will maybe recommend something like that for their patients, and then they take their recommendation to the veterinarian. And because the vet doesn't have great understanding about these medications, there's a bit of a block here, or there can be sort of a breakdown in, that kind of cooperative support network, because the vets maybe don't feel comfortable, but maybe the trainer has really great knowledge about psychotropic medications and might think this is a great option for their patient. And so this is where we also really want to be bridging the gap between professionals that work in that sort of behavior space and vets that maybe didn't get that great of an education around behavior, and how can we bridge those gaps, and how can we get everybody working together on the same page for the benefit of that patient. So that's why I decided to write this course, because I think there's so much that needs to be understood still, and a lot of ways in which we can address things better. And also, we don't want to be missing out on these great medications as ways of helping our patients. So What can you expect from Psychoactive? Well, Psychoactive is a multi-module course. So there's like over 9 hours of content in this course. And that might sound a little bit overwhelming, but the content is broken down into 6 modules with an introductory module. And in each of the modules, there are going to be lessons that are somewhere between 5 and maybe 35 minutes in length, depending on the topic. So they're broken down into these really kind of bite-sized lessons that are super easy to digest, super easy to go through. And each lesson kind of has one particular train of thought that's associated with it. And I think it's also really important to note that a lot of the information will pop up in different modules and different lessons. So we might start with kind of a foundational piece around a certain medication, maybe some of the neurotransmitters, but then we'll also bring it together in a practical sense in some of the modules and lessons on how you can kind of start to, associate the information with your patients and how it's going to help you make some medication choices around medications. So the information pops up in different ways. So it's not like it's 9 hours of brand new information and content. No, the information will be popping up in different ways, in different modules, in different contexts. And the idea is to kind of close those loops and to make those associations and bring everything together so that you can really start using the information in a very practical way. And it's hopefully going to help you think through some things and work through some things on how you then kind of choose the best medication or kind of get to the best outcome for that particular patient. So let me chat you through the modules one by one. So we start, like I mentioned, with a bit of an introductory module that just sort of sets the tone and, brings a little bit of clarification around what's to be expected. In module 1, we talk about what I call the players. Now, the players are our neurotransmitters because they are so important, so vital for understanding everything that follows. So we talk about neurotransmission, neurotransmitters, a little bit of pharmacokinetics and pharmacodynamics. We talk about different receptor types. We talk about the agonist-antagonist spectrum. And then already in that very first module, we have one lesson that's dedicated to how presenting behavioral signs, whether that's fear, anxiety, stress, or maybe hypervigilance, how those behavioral signs relate to neurotransmitters and how that's going to help us to make medication choices. So even already in the very first module, we bring in a lot of practical elements into it, and we kind of chat through how that's going to look from a practical point of view. In the second module, we talk a little bit about, well, quite a lot about how we make patient choices, which patients are going to be potential candidates for psychopharmacology. What are their sort of presenting pictures? How do they present? What are the contexts they present in? I've got some really kind of practical worksheets that you can go through in terms of deciding whether this is a patient that you might want to prescribe for or not. So we talk about the who are the patients? We talk about the when, like what are the contexts? What are the situations? We talk about why. Why do we want to think about prescribing psychotropic medications? We talk a little bit about constraints. So what are some of the legal constraints? What are some of the patient constraints? What are some of the caregiver factors that may or may not kind of point us towards choosing psychotropics? So that's all in module 2, is starting to think about who are going to be our patients and what are some of the things I need to think about. Module 3 is all about long-acting medications. So we define that. What are long-acting medications? Like, when would we use them? How do we use them? So we go into detail there, and then we go through the individual medication classes: tricyclic antidepressants, SSRIs, SNRIs, monoamine oxidase inhibitors. We talk about imepitoin, and then we talk about a couple of others. So those are our kind of long-acting medications, and that's what we talk about in Module 3. Module 4 is all about our short-acting medications. So again, we set the tone about defining them, what are the sort of situations we might use them in, and then we talk about the individual classes. So we talk about benzodiazepines, alpha-2 agonists, we talk about trazodone, we talk about gabapentin, and we talk about a few others that are deemed to be used as short-acting medications. So that's module 4. Then module 5 is my absolute favorite module. I had so much fun putting this module together. It's also the longest out of all of the modules. And that's because this is really kind of the practical approach. So how does it all come together? So we talk about, medication choices. We talk about how am I going to swap or stop medications, and when is that even going to be indicated? We talk about serotonin syndrome. We talk about some of the things we need to think about if we've got patients that are on long-acting medications and they come into the veterinary clinic, maybe for an anesthetic procedure. So we talk about things that we need to think about in terms of drug interactions. Again, we chat a little bit about contraindications. So all these practical questions. We also talk about how to treat difficult pets in the veterinary setting. So that whole kind of pre-visit pharmaceutical, and we extend on that massively. So really, this is kind of the practical stuff. It's the nuts and bolts of it. It's, really sort of the essence of using these medications either in an everyday setting, maybe in your clinic, or if you're seeing behavior patients, from a practical perspective. So yeah, this is my absolute favorite module 5, and it's got so much valuable information in there. And then in module 6, I talk a little bit about non-psychopharmaceutical products that we can use. So this is dedicated to pheromones, nutraceuticals or supplements, and then also diet. So we talk a little bit about what are the indications of using those, what can they achieve, when are they something I might consider, when are they something I might not consider, what are the different options that are out there, what's their neurobiochemical sort of activity like, and what do we think their sort of effects on our patients' brains are going to be. So this is a really great module that looks at some of the adjunctive things. We're always thinking about multimodal approaches. So how do these other things fit into our treatment plans, and how do they fit alongside our psychotropic medications? So that's module 6. So those are our 6 kind of big modules. But then in addition to that, I am offering live group Zoom calls. So currently they're kind of scheduled for once a quarter to give everybody an opportunity to get into the course, to start going through some of the things, to see where the questions are that pop up. What are maybe some of the cases that come up. But these live group Zoom calls are essentially for us to be able to connect on a one-to-one level, to chat through cases, to have some conversations about, some of the questions that might come up, about some of the medications, about, how some of the medications are working in individual patients. And this is really what takes sort of the online course, which is maybe a little bit two-dimensional, into the third dimension. So this is really your opportunity to touch base with me, to have those conversations with me, and to really start to get more confident about using some of the medications in your own patients. And I think this is going to be such a valuable piece to the course, to the program, and is really going to be, I think, that thing that makes the difference, right? It's not just going to be a course that you kind of go through on your own, on your laptop, and you try and figure it out for yourself. No, we've got these regular check-ins. Like I say, at the moment, they're scheduled for once a quarter, but depending on how the course grows and how many participants we get into the course, that might go to every other month, and then maybe even monthly in the future. So really something that is going to be hopefully of massive value, and where we can have those conversations. So another thing I should tell you about this course is that I have applied for RACE approval. It hasn't been granted yet. I only made the application a couple of days ago from the moment of recording this episode. But that's something that I'm also hoping to get for this course. And if that is so, then if we get RACE approval, then I'll be letting you know, if you're a vet or a vet tech based in the US, especially, how you can claim those CE credits. So there'll probably be a number of MCQ questions that you need to complete after the course, and then you will receive a certificate. As I mentioned, it's not yet RACE approved, certainly at the time of recording, which by the time the course actually airs, by the time the podcast episode actually airs, we may have already gotten RACE approval, but it's not yet approved at the time of recording this podcast episode. And if we do get approval, like I say, there'll be a little bit more information on that. So what else do I need to chat to you about? Well, one of the things I guess that's really, really important is that I started my career off as a general practitioner. So I have been a vet for over 25 years, and the majority of those years I've spent as a GP vet. So when I graduated, I did an internship And then I did a year and a half in general practice. Then I did move into a little bit of sort of the academia space. I did an anesthesia and analgesia internship, at Liverpool University. So I did kind of move a little bit more into that sort of specialist area. But then when I finished that internship, I went back into general practice. I did work at an emergency center for a while, doing a lot of sort of anesthesia protocols and some emergency work. And then in 2006, I moved over here to the UAE. And basically from 2006 until I did my residency in 2019, I did work solely as a general practitioner. And when I opened my own clinic in 2008, the first few years until I brought a second vet on board were literally just me on my own doing all the general practice work. And the reason I'm telling you this is so that you know that I can 100% relate to the general practice environment, and I can see things through a lot of different lenses. And I very much look at things through a GP lens. I know what the challenges are in sort of general practice work, and I fully understand that. But I also understand things from a specialist point of view. So when I started my residency in 2019, I basically started a behavior service within my general practice. And so that definitely operates now a little bit more as a specialist sort of practice, I guess, a little bit more of a referral practice, and that runs within a GP practice. And I can also very much look at things from that sort of specialist point of view. I know how veterinary behavior referral practices work from the time I spent with my mentors in the US and Australia. So I can also come at things from that lens. So if you're somebody who is also starting their journey, maybe in specialist veterinary behavior practice, or if you are a specialist practitioner, then I can also absolutely grasp things from that lens and from that point of view. And so again, I think that's where these kind of live group Zoom calls are going to be really interesting, because we're going to be looking at things depending on, where you're coming from. And I think that's another sort of piece of value that I can bring, is that I'm able to look at these things from all different angles. So that is a little bit about, who this course is for. At the beginning of the podcast episode, I talked a little bit about, yes, this course is for vets. But if you're not a vet and you're still really interested in this, then this course is also for you. You just need to know that you can't prescribe psychotropic medications. But in Module 6, as we dive into kind of those non-psychopharmaceutical agents, those are for sure things that might be of massive value to you. Okay, the final point is how can you kind of join this course? So in the show notes, I'm going to put the link to the course, and I'm going to invite you to come and join us. Now, on the date of the airing of this podcast, which is going to be the 22nd of April, we will still be at pre-sale price, which is $222 for the course. However, that's only going to be for another 48 hours, because the course launches on the 24th of April. And as soon as the course launches, the price will go up to its regular price, which is $555. So if you're listening to this podcast episode before the 24th of April and you're keen to join Psychoactive, to come along with me on this journey, then I would say get your place on the course really quickly, because it jumps up quite substantially from the pre-sale price of $222 to the regular price of $555. So now is your time to click on that link and to join us in Psychoactive. I think that's pretty much everything I have to say about the course. I think you can probably tell from this episode how excited I am about the course, how much I love putting it together. And I'm actually so happy that I put the course together quite soon after my board exams, because all of that knowledge is so fresh in my mind from studying for exams. And of course, I bring all that experience with me from now having seen almost 500 clinical behavior cases, many of which have been prescribed psychotropic medications by myself. So that's a whole bunch of patients that have, that have kind of been with me, and that I've been able to learn so much from and gain so much practical experience from, combined with that knowledge of having just studied for my board exams. I think I've put together for you a really special course. So that just leaves me to say, I can't wait to see you there. I can't wait to see you in the live group Zoom calls. I can't wait to have some of these really amazing conversations with you. I can't wait to meet some of your patients that you might be struggling with, and I can't wait to support you in implementing some of these things, either, the kind of the pre-visit pharmaceutical sort of scenario, maybe within your general practice setting, or maybe you are a vet that's actually seeing clinical behavior cases, and I can't wait to support you in those as well. So join the course. I can't wait to see you there. And I'm looking forward to seeing you in the next podcast episode, which will be episode 80. So saying goodbye for now and see you very soon. Bye.